of youth, a land of energy, vitality, and ambition. However, there's an increase in the prevalence of lifestyle diseases, that is, diabetes and hypertension. Risk factors responsible for these conditions are stress, sedentary lifestyle, obesity, smoking, and excess alcohol consumption. These lifestyle conditions are also affecting their vitality and energy, and in turn leading to one prominently occurring condition of erectile dysfunction. 52% of Indian males aged 40 to 70 years are suffering from ED, leading to decrease in their confidence level. Healthy sexual life helps in maintaining the feeling of youth and overall well-being in sexual disorder like ED. Zydus Fortisa, a division of Zydus Healthcare Limited, presents Men's Sexual Health Portfolio, which comprises of Penegra, Zydalis, You Desire, Sustanon. Penegra is the #1 prescribed brand of sildenafil with half-life of 4 hours, duration of action up to 8 hours. Penegra can be recommended for moderate to severe ED patient, long-standing diabetes patient, as efficacy is independent of age, duration of ED or diabetes. Zydalis is a brand of tadalafil that comes as mouth-dissolving, mint-flavored tablet. Zydalis has longer duration of action up to 36 hours with no dietary restrictions. Recommended for the treatment of younger 40+ mild to moderate ED patients. Provides spontaneity and better patient compliance. Sustanon is a brand of testosterone used in the management of ED with hypogonadism. Sustanon shows considerable increase in duration and maximum level of penile rigidity. Improved libido in hypogonadal men. You Desire is the brand of Sildenafil, which gives assurance of efficacy and safety. Help your ED patients to feel youthful and maintain overall well-being with the benefits of Penegra, Zydalis, Sustanon, and You Desire. Land of youth, a land of energy, vitality, and ambition. However, there's an increase in the prevalence of lifestyle diseases, that is, diabetes and hypertension. Risk factors responsible for these conditions are stress, sedentary lifestyle, obesity, smoking, and excess alcohol consumption. These lifestyle conditions are also affecting their vitality and energy, and in turn leading to one prominently occurring condition of erectile dysfunction. 52% of Indian males aged 40 to 70 years are suffering from ED, leading to decrease in their confidence level. Healthy sexual life helps in maintaining the feeling of youth and overall well-being in sexual disorder like ED. Zydus Fortisa, a division of Zydus Healthcare Limited, presents Men's Sexual Health Portfolio, which comprises of Penegra, Zydalis, You Desire, Sustanon. Penegra is the #1 prescribed brand of sildenafil with half-life of 4 hours, duration of action up to 8 hours. Penegra can be recommended for moderate to severe ED patient, long-standing diabetes patient, as efficacy is independent of age, duration of ED or diabetes. Zydalis is a brand of tadalafil that comes as mouth-dissolving mint-flavored tablet. Zydalis has longer duration of action up to 36 hours with no dietary restrictions. Recommended for the treatment of younger 40+ mild to moderate ED patients. Provides spontaneity and better patient compliance. Sustanon is a brand of testosterone used in the management of ED with hypogonadism. Sustanon shows considerable increase in duration and maximum level of penile rigidity. Improved libido in hypogonadal men. You Desire is the brand of Udenafil, which gives assurance of efficacy and safety. Help your ED patients to feel youthful and maintain overall well-being with the benefits of Penegra, Zydalis, Sustanon, and You Desire.
Okay, my friends, all healthcare providers, all yoga masters, yoga enthusiasts, warm welcome to you all for this yoga and sex webinar, appropriately placed today. This yoga is originated from Vedas of India way back thousands and years back before Christ. Roughly, the available text says that it is more than 5,000 years BC. All these yogas are systematically arranged by sage Patanjali in Yoga Sutra around 150 BC. Hiranyagarbha is considered to be the father of yoga. As far as the present day knowledge understanding goes, it is the Patanjali, the Indian sage, who is the compiler of yoga science. He is the father of yoga science. He is believed to be incarnation of Adishesha. So if you come to a little bit religious side, Hindu philosophy believes the Vishnu, the savior god, lies on the serpent called Adishesha. That Adishesha in next generation taken a birth as our sage Patanjali. He wrote Yoga Sutra containing 195 verses, divided into 4 chapters. So he is the sage Patanjali who wrote the treatise on this Yoga Shastra, Patanjali Yoga Shastra. It contains 8 Ashtangas. So he had divided mainly into 8 types, namely Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. Last 3 are meant for higher intellectuals to get salvation. They are going into higher levels. So for the sake of benefit of the body and derive maximum benefits, the first 5 things, Yama, Niyama, Asana, Pranayama, Pratyahara, are sufficient. So they are meant for external parts. Last three are meant dharana, dhyana, samadhi, meant for internal parts. Same thing in Hatha Yoga also. This Hatha Yoga again deals with the Satkarma, Asana, Mudra, Prana, Pratyahara, Pranayama, Dhyana, Samadhi. Asana and Mudra are taken into the physical yoga postures, which our next speaker, Sudhakar Pettar, is going to talk about this. So this practicing yoga, art of practicing yoga helps in controlling the individual mind, body, and soul. It brings together the physical and mental disciplines to achieve a peaceful body and mind. Practicing yoga helps to manage the stress and anxiety and keeps the practitioners relaxed position. It makes mind and body relaxed and calm. My friends, always remember, initially when we start practicing yoga, it has to be practiced under a supervision, under a guru, under a senior person, under a yoga master, because the movements of the yoga, there are certain things in the body may not be suitable for that movements. For example, heart problems, imbalance of the ear fluid, fractures and dislocations, unsteady blood sugar levels and blood pressure levels, glaucomas, infectious diseases, spinal problems. So all these things, initially, the yoga master will tell you which yoga positions will be suitable to you, which how to practice. Once you are trained and once you have become master about this, you can individually can practice. Today, the stress of modern living can cause curb the sexual energy. So yoga can help to release built-up tension, leaving both body and mind more receptive to your own and to your partner's sexuality. That's why today the theme of webinar is yoga and sex. So this internationally every day, every year, 21st June is observed as a International Yoga Day. This idea of starting International Yoga Day is again given by our beloved Indian Prime Minister, Sri Narendra Modi ji, during his speech in United Nations General Assembly on 27th September 2014. When he was delivering his speech, he proposed that for the sake of entire globe peacefulness, globe happiness, he proposed a hypothesis called yoga, which is the already it is established fact in Indian practice. So he proposed the idea of starting observing a International Yoga Day for the benefit of all humankind on the globe. And he proposed 21st June because that day is the longest day in the year in the northern hemisphere, and significance, special significance for different parts of the world. His proposal was well taken by all the member countries, and discussions went on. And in the year December 2014, the UN has clearly accepted the proposal by Sri Narendra Modi ji, and they said by 2015 onwards, we are going to observe 21st June as the International Yoga Day. Hence, my friends, from 2015 onwards, we are observing this today as the International Yoga Day. Today is the 6th year for this International Yoga Day. In 2015, the first International Yoga Day, the theme was synergy. On first Yoga Day, Indian Government Reserve Bank has issued a 10 rupee commemorative coin. You can observe that coin containing the World Yoga Day. That is the first time it released that coin as a souvenir to commemorate the International Yoga Day. Next year, 2016, the theme was Connect the Youth. Next year, it was Yoga for Health. 2018, yoga for peace. 2019, yoga for heart. 2020, yoga at home and yoga with family. This theme is taken because of the prevalent corona pandemic. At the same time, today being the solar eclipse. So total throughout the world, all yoga enthusiasts observed the yoga at home and along with the family members. So this International Yoga Day today celebrated on the digital platforms because of the COVID-19. And yoga has been beneficial for years, not only for losing weight, but also for keeping mind and soul calm and boosting our immunity and all the more enhancing our sexuality. So to raise about the awareness of yoga and to inspire the people, today, many governments across the globe, including Indian government, has given a choice. Please come out, those people who are practicing yoga, who are experiencing the benefits of yoga, come out with my life, my yoga videos. So there will be a lot of gifts will be given for that, first prize, second prize, third prize, like that. For this, our one of the speaker has contributed to a great. We are going to see that in coming slides. If you look at the benefits of the yoga, why should we practice yoga? Means a lot of benefits are there. Not only physical benefits, many psychological benefits also. Physically, it improves the flexibility. It builds the muscle strength. It prevents the cartilage and joint breakdown. It betters the bone health. It increases the blood flow. It drains the lymph and boosts the immunity. It decreases the blood pressure. That is the most advantage thing. So people who are hypertensive, those who are regularly practicing this yoga can be benefited. Their blood pressure will come down. Regulates the adrenal glands. So a lot of adrenaline, cortisol will be reduced. A lot of anxiety will come down. This anxiety is because of the increased cortisol level, adrenaline level. That will come down. Makes you calm and happy. It lowers the sugar levels. It increases the HDL. That is very, very beneficial for the heart. It makes you to get a better sleep. It gives you your lungs room to breathe. So lung vitality, vital capacity of the lungs will increase, which is very helpful for this COVID virus. It keeps your heart in good condition, prevents irritable bowel syndrome and the digestive problems. And all the most last one is benefits your sexual relationships. So today, the webinar we have taken theme yoga and sex because of the last one. So please welcome with a great applause. Put your hands together and welcome our international speaker, Dr. Su Yin Yap. She is a consultant clinical psychologist. She is Associate Fellow, British Psychological Society. She is accredited psychosexologist by the European Federation of Sexology. She works in national health schemes in the UK and practices in London. And all the more, she is a yoga enthusiast. Please welcome. Thank you, madam, for accepting our invitation. Welcome to the webinar. The next international speaker is our good friend, Dr. Palash Rai from our friendly country, Bangladesh. He is Assistant Professor and Head Department of Psychiatry, Mymensingh Medical College, Bangladesh. He is a member of Bangladesh Society for the and life member of ISAM, International Society of Sexual Medicine, and a member of SASAM. And all the more, he is also yoga enthusiastic. My friend Dr. Rai, please welcome. Thank you for accepting, Roy, and we welcome you to this webinar. Then coming to our Indian expert, Dr. Sudhakar Petkar, who is a ex-HOD, Department of Preventive Medicine. Now he is not only he is enjoying the benefits of yoga, now he is sharing his knowledge of yoga to many people. And he has authored many chapters and many books. He's having 40 years long experience in teaching yoga and sex. And furthermore, today, he has contributed to the nationality and to the internationality, pranayama for corona. This is a great contribution. We congratulate you, Petkar, and at the same time, we welcome you to this webinar. With this, now I close my talk. I will invite Dr. Petkar to give his presentation on yoga for sex. Over to Petkar, please.
Thank you. Good evening, everybody. I, Dr. Sudhakar Petkar from India, welcomes all of you. Today is the auspicious day, International Yoga Day, and we have to celebrate it. I'm really thankful to the organizers and Venkatramana for giving me a chance to speak in front of you. It's a really worth. You see, Mr. Sheikh Patanjali gives this golden gift to this modern world, stressful modern world. What is this? Everybody wants to live long, live healthy, live happily, and have a happy, long sex life. Is it possible? Yes, it is possible. It is with the yoga. It is with the yoga only it is possible. Yoga and pranayama. Ramana said that yoga is this Ashtanga Yoga is constituted eightfold. That is yam, niyam, asan, pranayam, pratyahar, dharana, dhyan, and samadhi. Out of that, these two yogasana, they are related with the physical fitness, and pranayama for mental stability. You see, mental instability, mental stress, anxiety are the very common nowadays, and it causes many psychosomatic diseases. Which are the psychosomatic diseases they are causing? They are diabetes, blood pressure, gout, hyperlipidemia. There are many, and many sexual problems in male, premature ejaculation, then erectile dysfunction. In females, there is vaginismus, then dyspareunia, frigidity. All these are the very common problems they are facing. It is due to the stress only and due to the physical laxity. So our sedentary lifestyle is one of the very important cause for all this. Our abdominal fat is increasing, obesity is increasing, and that increasing obesity gives these types of the metabolic disease. Is there any answer? Is there any answer? Yes, there is an answer to have a good sex life, to have a good, a healthy life. For that, you have to do the yogasana and pranayam regularly. That is very, very, very important. It is a preventive as well as curative. For those who are not having any problem, they can do it and they can enjoy their life. They can have a healthy life. And those who have problems, they can go for the curative purpose. Here, I have selected some yogasana and pranayam. I am not going into depth of these asanas. I am just giving the demonstration, and it will be helpful to you to proceed further to have a healthy, happy sexual life. Not only sexual life, but life. Yoga. This sex is one of the part of our other systems, our body. You have respiratory system, digestive system, excretory system, cardiac system, nervous system. All systems are taken care by this yoga. Now we will switch on these yoga practices and demonstration. Now we will proceed further. This is, we have to increase our sexual stamina. Various yogic asanas, especially pelvic floor muscle asanas are very much useful for this. Now you are seeing the Hastapadasana. What is this Hastapadasana? It gives the setting. I will give the just benefits. Which are the benefits? It is effective to increase the height in adolescent period. It reduces the belly and fat of the abdomen, improves the digestive system, strengthens the spine and brings the flexibility, increases the blood flow of the brain and reduces the menstrual problem. This is Hastapadasana. Next is Kati Chakrasana. You can see the Kati Chakrasana. It is the rotation of the spine. It strengthens the back and abdominal muscles. See, you just say it and take the benefit at home. It strengthens, tone up the digestive system, excretory system, and reproductive system. It gives good shape to our body. You can see that yoga gives the boost to develop our personality. This is a Kati Chakrasana. It gives a very nice tone to the back muscles.
Sir, can you stop the mute that
Yeah.
video's voice? Yeah.
Yes, sir.
Sir, mute your video's voice so we can hear you clearly.
You are not able to hearing.
Yes, sir.
Now you can.
Sir,
Oh,
sir, he just
background
meant to
music.
say that the video's music, you can minimize it because
Yes,
we're
yes,
unable
I
to
will
hear
minimize
your speech.
Minimize.
So we can play the video with no music in the video so we can listen to your session, sir.
Okay, okay.
Yeah. Thank you, sir.
Is it? Are you listening some music?
No, sir. Now it's perfect.
Okay.
Now we can hear you very clearly. Thank
Okay,
you,
okay. We are now seeing the Paschim Tanasana. That is the backstage posture. This is a backstage posture. What it does, what is the benefits of this Yogasana? This is strengthen the back muscles, help to reduce the stress, anxiety, and depression, stimulates the liver, kidney, ovaries, and uterus, relieves the symptoms of the menopause and menstrual discomfort, and it improves the digestive system. This is Paschim Tanasana or backstage this one, Yogasana. Now, next is Yoga Mudra. This is Yoga Mudra. It increases the flexibility to the back and the spine and the hip. Tone up all the abdominal organs. You can see this one. Now, our next demonstration is Ardha Machindrasana, or it is also called as half twist posture. What is the benefit of this? Very good asana to control the diabetes. It gives the pressure on the pancreas, helpful to control the obesity, and spine becomes flexible. Spine becomes flexible. You can see it. It can be done on the right side also and to the left side also. See it. How he is doing very nicely. This is Ardha Machindrasana or half twist pose, half twist posture. He is my colleague. He is seated erect. Erect position is very important. Don't bend forward or backward and comfortably. Don't do overdo. That is very important. Don't do any asana or any pranayam more. Don't get exhausted. Then our next is Supta Vajrasana. That is supine ankle pose. Supta Vajrasana. What it gives? What is the benefits of the Supta Vajrasana? It gives good stretch to the thigh, then knees, ankle, abdomen, and hip muscles. It improves the menstrual discomfort, help digestive, helpful to the erectile dysfunction, premature ejaculation, erectile problems. This is Supta Vajrasana. Do Every asana slowly and comfortably. Don't make any hurry. That is a very important. Slow actions are very important in any asana. Then next asana is Vajrasana. That Vajrasana, continuous doing the Vajrasana, it said that the penis becomes as hard as our god Indra, that is Indra's weapon, Vajra. That's why it's called as a Vajrasan. That's why it is called as Vajrasan. What is the usefulness of this asana? This is very useful for the premature ejaculation and erectile dysfunction. It improves the digestive system. After this, it comes a next asana, that is Pavana Muktasana. There are many asanas on standing, on lying down on the abdomen, lying down on the back of the muscles. You can see this is Pavana Muktasana, this is gas-free pose. This is gas-free pose. What are the benefits of this Pavana Muktasana? It tunes up the abdominal muscles, reduces the abdominal fat, improves the digestive system, strengthens the back muscles, and improves the flexibility. Improves the flexibility and help to control the diabetes also. This is Pavana Muktasana, gas-free pose. Bloating of the abdomen, indigestion causes discomfort in the body. Now we are going to Halasana, that is a flow pose. That is a flow pose. You can see how he's taking the leg up and back. What is the benefits of this Halasana? It helps to control the diabetes. It is useful for the insomnia, act on the thyroid and parathyroid glands, increase the efficiency of the genital organs. It increases the efficiency of the genital organs. I am seeing again and again. You can see how beautifully he is doing. This is Halasana or flow pose. Slow action is very, very, very important, and it should be done on the empty stomach. Now our next asana is Bhujangasana or cobra pose. What are the benefits of the Bhujangasana? It strengthens the spine, relieve the stress and fatigue, preventive as well as curative for the backache, and it stimulates the abdominal organ and increases the sexual efficiency. It increases the sexual efficiency. Yoga acts on every part of the body, but especially these asanas act on the sex organs. Now our next asana is Shalbhasana or locust pose. Locust pose, Shalbhasana. What are the benefits of this Shalbhasana? It is helpful in sciatica and backache. It reduces the fat around the abdomen, hip, waist, and thigh. It increases the pelvic floor muscle tone, help to reduce the BPH problem, benign prostatic hypertrophy problem, it reduces, and it increases the efficiency of the sex. Now, it is also helpful for the urinary incontinence and premature ejaculation and erectile dysfunction. Our next asana is boat pose, or which is also called as Naukasana. What is the benefit of this boat pose? Raise the hands above the neck and legs simultaneously. You can see it. It improves the health of the abdominal organs. All the abdominal organs help to regulate blood sugar level. These are the very obstacles, blood sugar, blood pressure. These are the very much obstacles in having a pleasure in the sexual life. Now, our next asana is Dhanurasana. It improves the tone of the back muscles. It is Dhanurasana. Now you can see it. It is the bow pose. It improves the tone of the back muscles, improves the digestive and endocrine system, and it also helps to control the BPH, that is benign prostatic hypertrophy. See how the action is. Slow action, steady action, controlled action. These are the very, very important. We are now switch on Viprit Karni or balancing asanas. Balancing asanas. That is, now we are seeing here the Viparit Karni. That is called as stand on elbow pose. Stand on elbow pose. What is the benefit of this? It increases the blood flow to the brain, helps to relieve the menstrual cramps, and it is a preventive for hernia and varicose veins. It helps testicular, semen, and ovarian problems. Come slowly. See how slowly he is coming. Slow action, controlled action. And it improves the digestive system also. Now we are switching on Sarvangasana. Sarvangasana, it develops the body, that's why it is called as Sarvangasana, that is stand on shoulder pose. Stand on shoulder pose. See it. What are the benefits? It improves the eyesight, improves the work efficiency, it improves the thyroid and parathyroid glands function, and improves the blood circulation. This is Sarvangasana. For this, every asana, empty stomach is very important. If you have any question, you can ask me afterward. Now we are going to see next asana, the king of the asana, that is Shirshasana. That is stand on head posture. It is not a circus, just see it. It is not a circus. You can take support also. What is the benefit of this Shirshasana? It relieves the stress, improves the blood flow to the brain, improves the digestion. Improves the digestion. You can see it. These are the balancing asanas. Viparit Karni, Sarvangasana, and Shirshasana. These are the balancing asanas. You have to balance yourself. See how steady he is. Come down very slowly, very slowly. Now we are going to see the Surya Namaskar, that is salute to the sun. It includes 12 asanas, and these 12 asanas are constitutes one rotation. You can do it 12 times. Now this is the Pranamasana. Next is Tadasana. Then you should bend down and exhaling, come down. That is Hasta Padasana. Then comes the Ashwa Sanchalan with keeping right leg front and back leg, left leg back. This is Ashwa Sanchalan with right leg. This is Parvatasana. This is Ashtanga Namaskar, salute with the 8 limbs. Ashtanga Namaskar. Then comes a cobra pose or Bhujangasana. After that, 8th pose is Parvatasana. Then 9th is Ashwa Sanchalan by changing the leg with the left leg. This is 10th, Hasta Padasana, forward bend posture, then come up, and this is Tadasana. And then 12th is Pranamasana. What are the benefit of this? It helps to lose the weight, glow the skin, relieves the anxiety, tune up whole body. We have to switch on our pranayam. Pranayam. What is the help? What is the benefits of the pranayama? It improves the sleep quality, reduces the high quality, high blood pressure, increases the oxygen carrying capacity. All body systems get rejuvenated, increase the vital capacity of the lungs, and make the body to fight with the corona. This is Om recitation. You have to recite Om. By this way, this is Om recitation. What is the benefit of this Om recitation? It improves the concentration, reduces the stress and anxiety, brings the sound sleep, make emotionally stable. This is Om recitation. You can do it 3 times, 5 times, as per your capacity and as time permits you. This is Omkar Dhyan or Om recitation. Our next pranayam, it is the preparation of the pranayam. It is not a pranayam. It is the preparation of the pranayam. Our next is, you can do it 2 times, 3 times according to your wish, how the time permit you. Yes. Bring the hands down 3 times. Then brings it down, hand down. Rub your hands, place on your face, and proceed. Now we have going to for Nasa Marga Shuddhi, that is nasal cleansing exercise. 10 times from left nostril, 10 times from right nostrils, and 10 times from your both the nostrils. Contraction of both chest and abdomen. You have to do this Nasa Marga Shuddhi, or that is called as a nasal cleansing exercise. It clears the nasal passage, expels the toxins, bacteria, viruses, then mucus from the nasal passage. When some VIP guest is coming in our house, we are cleaning everything. Oxygen is our VIP. He is a guest in our chest, and we have to welcome him. How? With this Nasa Marga Shuddhi, removing of all the blockages. This is Nasa Marga Shuddhi. And 10 times from both the nostrils. This way, contraction of the chest and abdomen. This is very important here. And forcefully exhale. Forcefully exhale. Now we are switching on Kapalbhati, or that is called as a forehead brightener. Forehead brightener. No, we are going on Anulom Vilom. Anulom Vilom, that is alternate nasal breathing. What are the benefits of this Anulom Vilom? It treats the snoring, make the mind stable. It is useful for the improvement of physical and mental health. What you have to do? Take the inhale from right nostril, hold it for 6 count, and exhale from left nostril for 3 count. Then 3 count you can take from left nostril, then hold for 6 count and exhale from the right nostril. This is one rotation. This is one rotation. That is alternate nasal breathing. That is alternate nasal breathing. You can see it. And what are the benefits? I have already told you. It is very useful for the snoring. It is very useful to make the mind stable. Now we are going for the Kapal Bhati. That is, now we are going on Ujjayi Pranayam. In this Ujjayi Pranayam, you are taking breath inside with partially closing the glottis and making a sound. This is Ujjayi Pranayam. Take the inhale 4 count, hold for 6 count, exhale for 8 count, and then you stop for 2 counts. That is Purak, Antarkumbhak, Rechak, and Bahirkumbhak. You can do it. And what are the benefits of this victory pranayam? It increases the vital capacity of the lungs. It will help to fight with the corona, regulates the breathing, make mind stable, and improves all the body systems. It improves all the body systems. Now we are going to the Bhastrika Pranayam. Bhastrika Pranayam, there are 2 parts, active and passive. First you inhale, then forcefully exhale and inhale for 20 times. Then take the deep breath inside. Do the Jalandhar Bandha, Udyan Bandha and Mul Bandha. Hold it as far as possible. If you are able to hold 30 to 40 seconds, see that there is no corona in your body. There is no corona in your body and there is no cardiac element with you. It is a kumbhak. Then this is the active part. Now you are doing passive part. Leave the Jalandhar Bandha. This is holding the breath. Holding the breath is not easy task. It is not at all easy task. And exhale from the left nostril. Leave the bandh and exhale from the left nostril. Complete controlled exhalation is very important. This is Bhastrika Pranayam. What is the usefulness? It is good for the brain oxygenation. Then it improves the depression and anxiety. Now we are going to see the Shitali and Shitkari Pranayam. Shitali and Shitkari Pranayam. Roll the tongue. Take the air, breath from the mouth. We are going to the Shavasana. We are going towards the Shavasana. It is very important asana. It is the king of the asana. You have to do, relax your mind, relax your body with conscious mind. Don't take any type of the sleep. You can see how to do it. Take the leg apart. Turn your face on one side. This is Shavasana. What is the usefulness of this? It removes all the mental and physical tension and it relaxes the body and mind. It is good for the rehabilitation of the cardiac patient. It is good for the rehabilitation of the cardiac patient. You can see it. This is Shavasana. Now, what is the conclusion of all this? What is the conclusion of all this? It is stable mind and physical fitness plays an important role on sex. This mind and body is controlled by the yoga. Yogasana and pranayam make you to relax the mind, enjoy the sex, which makes sex life better than the previous one. But only thing is that Yogasana is not a single day procedure. Yogasana and pranayam, you should do it regularly and it should be your lifestyle. That is very, very important. Now, I should say thank you for all of you listening my lecture patiently, demonstration patiently. Thanks a lot.
Thank you, Sudhakar. Excellent presentation. You have given us a lot of new thoughts and lot
I
of
have tried
information.
my best.
Yes, excellent. Thank you.
And these are the selected asanas.
Now we will go to the next speaker, Dr. Palash Rai from Bangladesh. He is going to speak on usefulness of yoga for male sexual dysfunctions. Over to Palash Rai, please.
Can you hear me?
Yes, yes. Go ahead.
Okay. Learned speakers and my beloved audience, take a very good evening from me. And I, Dr. Palash Roy, Assistant Professor and Head, Department of Psychiatry, Mymensingh Medical College from Bangladesh, are welcoming you all for today's topic, that is usefulness of yoga in male sexual health. Before going to discuss the yoga, I want to tell something about human sexuality, that is the normal human sexuality. And as you know, that normal human sexuality is a process by which people experience and express themselves as sexual beings and has a consistent focus of curiosity, interest, and analysis of humankind. And sexuality is determined by anatomy, physiology, and culture in which a person lives, relationships with others, and developmental experiences throughout the life cycle. It includes the perception of being male or female and private thoughts and fantasies as well as behavior, and also the normal sexuality is devoid of inappropriate feelings of guilt or anxiety and is not an compulsive act. Human sexual behavior can be influenced by several aspects that can be categorized as anatomical perspectives, and that includes the primary sexual organs, secondary sexual characteristics and organs, and the physiological perspective that includes the facts, the system that regulates the normal sexuality, that includes the hormonal systems, neurotransmitter systems, and the sexual drives. If we want to, if we go for the psychological perspective, that can be explained by cognitive and learning theories. The cognitive theory explains how a stimulus or a stimulation is interpreted and how the individual will respond to that stimulus. And the learning theory postulates that environmental factors that shape sexual behavior. When sexual activity is pleasurable, it reinforces, as well as when the sexual activity is restricted, punishable, and full of shame, then people may come to associate sexual stimulation with feelings of guilt or anxiety. Every person, every man goes through the asexual cycle. That includes the four phases. That is desire, excitement, orgasm, and resolution. And between the excitement and orgasm, there is the plateau phase. In the desire phase, the desire phase is characterized by sexual fantasies and the conscious desire to have sexual activities. Desire may be biologically driven, or it may be a person's wish to bond sexually with particular partners. And the excitement, when desire is comes, and then the excitement phase starts, and it starts on by psychological stimulation or by physiological stimulation. The psychological stimulation, that is the fantasy, by presence of a loved object, or foreplay, stroking or kissing, and the excitement can be possible by combination of that two factors actually. And the excitement phase is consist of subjective sense of pleasure and the objective signs of sexual excitement. When the sexual excitement is peak, taking it peaks, then it release of sexual tension by rhythmic contraction of the perineal muscles and pelvic reproductive organs. And this is the subjective sense of ejaculatory inevitable triggers of the man's orgasm, and the forceful emission of semen, 4 or 5 rhythmic spasm of the post-examinal vesicle bus and urethra. After that, the forceful ejaculation of semen is occurred. And after the orgasm, there is the resolution phase. The resolution consists of the disgorgement of the blood from the genitalia, that is detumescence, and body back to its resting state. If the orgasm occurs, resolution is rapid. A subjective sense of well-being, general and muscular relaxation takes place there. The sexual activity can be related to different factors actually. That is the mental or physical factors, and as well as the mental and physical well-being, as well as the relationship satisfaction. The physical health factors, that includes the diabetes, cardiovascular disease, chronic disease, and cancer. And the lifestyle factors, obesity, smoking, alcohol, sedentary lifestyles. Along with that, there are some drugs that commonly cause male sexual dysfunction. That commonly we can take that drugs, commonly use these drugs, and that is some antidepressant, some cardiovascular drugs, antibacterial, anticholinergic drugs. If we discuss about the psychological causes of human sexual disturbance, male sexual disturbance, stress is the main culprit, and chronic stress, ongoing stress over an extended period of time can affect on testosterone production, resulting in a declining in sex drive or libido, and that can cause the sexual dysfunction. Other psychological factors, that are the performance anxiety, depression, loss of interest or relationship problems, may also cause a male is able to see their sexual person. There are several studies about the prevalence of male sexual dysfunction, and it found that about 10 to 52% men at some point in their lives will experience some types of sexual dysfunction. And one study in Journal of American Medical Association, 1999, found sexual dysfunction common in 31% of men, age range 18 to 59. And this is the projected global prevalence of erectile dysfunction in millions by the year 2025. And this is alarming that in Asia, by the year 2025, about 200 million people, 200 million male will be suffering from erectile dysfunction. The psychomedical approach to treating the sexual difficulties has a relatively short history. Despite the mental distress, anxiety, embarrassment, and depression, most men with sexual dysfunction, sexual problem, do not seek help actually. In this slide, I want to show that about 10% of people who are suffering from erectile dysfunction are seeking help from medical help, and 99% of US males in this study never seek care for sexual problems. Now I want to tell something about some facts about yoga. We know that yoga is a Sanskrit word that meaning union, and this is the oldest and most complete system of personal development in the world. And in another sense, we can say that yoga is life science, not a religion. That's because it encompasses the mind, body, and spirit. Yoga helps encourages proper breathing, calms the mind, reduces stress and anxiety, aligns the muscles and bones. There are 4 types of yoga. Karma yoga, that utilize the body. Jnana yoga utilize the mind. Bhakti yoga utilize the emotion. And Kriya yoga utilize the energy. And we should keep in mind that every individual is a unique combination of these 4 factors. Our body has 7 chakras and 72,000 nadis, and Yoga and good health is requires the free flow of the prana, that is the life force in the nadis, and the proper balance of all seven chakras. Regular practicing of meditation, pranayama, and asanas helps to balance the balance and realign and cleanse the chakras as well as the nadis. Yoga is essentially a path to liberation from all bondage. And however, medical research in recent years has uncovered many physical and mental benefits for uh, regular yoga practitioners. Yoga is beneficial for physical fitness, brain functions, and a strong heart, good sleep, good mind, and it may also cause perfect body shaping. And this is the in this slide, I want to show the mechanism of benefits. Maybe this is the postulated mechanism that how yoga can some prevent and control some disease and some adverse events of our life by doing yoga. Actually, yoga is essentially a path. Where is the yoga and sexual health? If I want to say that, yoga theory proposed that certain diseases maintain pertaining to sexuality suggest blocker stagnant energy in the root chakra, that is Muladhara. One way to release this energy is to raise or move one's kundalini through the spine and up to the brain through the nadis. The tantric practice and kundalini yoga is used as a tool to prepare for the movement of kundalini energy. In doing so, one may gain awareness of oneself and release the energy that may be sustaining the source of blockage or stagnation. And kundalini energy has been said to increase sexual pleasure and extend the longevity of sex by facilitating male orgasm without ejaculation. Another way, yoga cause physical postures, yoga, that is asanas, and breathing exercise improve muscle strength, flexibility, blood circulation, and oxygen uptake, as well as hormone function, and decreases anxiety and stress. And the relaxation induced by meditation helps to stabilize the autonomic nervous system with a tendency towards parasympathetic dominance, all including all that alleviate the male sexual problem. Actually, this is the proposed mechanism of beneficial effects of yoga in male sexual disorder, specifically in premature ejaculation. As we see that person who go through regular yoga practice, he has improvement on his quality of life, control of anxiety and depression, improved reproductive function, improvement in age-related declination of testosterone levels, and reproductive behavior and mood, reduced level of cortisol and catecholamine, increased serotonin, 5-hydroxytryptamine levels, inhibition of the sympathetic activity as well as stimulation of the parasympathetic activities, and control of pelvic and perineal muscle. With all these things, ultimately it improves the premature ejaculation along with the other male sexual problems. Yoga practices includes the cleansing process, postures, that is asanas, controlled breathing, pranayama, meditation, relaxation, and chanting mantras. The kriya, that is the cleansing process, in tantric breathing technique, a variation of kapalbhati is recommended to prolong sexual intercourse. And rapid puffing out of the air through the mouth cause prolonged ejaculation. That is proved actually. Here is the how if you want to do kapalbhati, say first of all you have to sit comfortably with your spine erect. Place your hand on the knees with palm open to the sky. Close the eyes and relax the whole body. Inhale deeply through both nostrils. Expand the chest. Expel the breath with forceful contractions of the abdominal muscles and relax. And do not strain to the abdominal muscles. And continue active or forceful expiration and passive inhalation and complete a 30 rapid breath. Then take a deep breath and exhale slowly. This is one round of Kapalbhati, and each round shall be followed by a deep breathing and repeat 2 or more rounds. There are several yoga postures and asanas, and yoga posture emphasizes the relationship between body, mind, and awareness. It focuses on the synchronization of breathing and movement. Uh, the standing pose that strengthens the pelvic area and tones of the reproductive organs, improve circulation to the pelvic region, and develop the ability to retain seminal fluid and prevent premature ejaculation. There are some, there are a lot of standing pose, but for sexual improvement, we suggest the following asanas, that is Garudasana, Trikonasana, Uttanasana, and Vatyanasana. The Trikonasana means the triangle posture. Trikon means a triangle, as the asana resembles the three arms triangles made by the Trikon trunk and limbs. It has been named Trikon. And if you want to do this, you have to first stand with your feet comfortably apart and slowly raise both the arms sideways till they are horizontal. Exhale slowly, bend to the right side and place the right hand just behind the right foot. The left arm is straight up in the line with the right arm. Turn the left palm forward, then turn your head and gaze at the tip of the left middle finger. Remain in the posture for 10 to 30 seconds with normal breathing. As you inhale slowly, come up, repeat for the left side. Seated poses that improves the health and sexual health also of the reproductive and urinary system and circulation to the pelvic area, improve the tone, flexibility of the perineal and pelvic muscles. And these poses are helpful for premature ejaculation as well as it facilitates the higher arousal, and this is result for better control orgasm. The sitting poses, including the yoga mudra, that is forward bend, Janu Shirshasana, and Upavishta Konasana, Vajrasana, and Shashantakasana. This is the pose of Vajrasana, and it names from the Sanskrit word Vajra, which means diamond or thunderbolt. Asana, and this diamond pose is also called adamantine pose. And if you want to do this pose, you have to first start by kneeling on the floor. Consider using a yoga mat for your ease or for your comfort. Pull your knees and ankle together and point your feet in line with your legs. The bottom of your feet should face upwards with your big toes touching the floor. Exhale as you sit back on your legs. Your buttocks will rest on your heels and your thighs will rest on your calves. Then you put your hands on your thighs and just your pelvis slightly backwards and forwards until you feel some comfort actually. And breathe in and out slowly as you position yourself to sit up straight by straightening your spine. Use your head and pull your body upward and press your tailbone towards that is coccyx towards the floor, straightening your head and head to gaze forward with your chin parallel to the thigh, and try to stay in this position for a minimum 5 to 10 minutes. Then go back to your previous position. The prawn pose that strengthens the pelvic region and tone the reproductive organs, stimulates the sexual energy centers, facilitates the stronger orgasm, and also useful in arousal difficulties, that is premature ejaculation. That includes the Shashanka Bhujangasana, Dhanurasana, and Uttan Pishtasana. And the Bhujangasana means snakes or cobra. In this asana, the body is raised like hood of a snake. And if you want to do this, you have to first lie down in your stomach, rest your head in your head, and relax the body. After that, now you join your legs and stretches your arms. Keep the forehead on the ground, and now place your hands just beside the body. Keep palms and elbows on the ground. As you inhale slowly, leave the chin and chest come up to the navel region. Stay there comfortably. This is called Sharala Bhujangasana. After this pose, Now come back and place your forehead on the ground and keep your palms beside the chest where your elbows were and where your elbows were and raise the elbows and inhale slowly, lift the chin and chest up to the navel region. This is the Bhujangasana. And exhale, rest of your exhale, then rest your forehead on the ground and place your palms and rest your head on the palms and spread your legs and just relax. The supine poses improve the tones and flexibility of the perineal and pelvic muscles and also strengthen the pelvic area, tone and reproductive organs. And this is the how it can help to improve male sexual function. And it includes the Shukta Vajrasana, Setubandha Sarvangasana, Sukta Baddha Konasana, and Matsyasana, that is fish pose. And the Matsyasana in Sanskrit, Matsya means fish. So this pose is called in English as fish pose. And if you want to do so, first of all, you have to sit in lotus position, have a couple of slow and deep breath, then bend slowly backwards and lie on the floor without releasing lotus posture. Support your body with your forearms and elbows with bending backwards. Lift the chest a little upwards and turn the crown of your forehead towards the floor and make an arch uh, of the back of the maximum comfortable extent. Hold on the big toes and touching to the floor. Now the body is supported by the legs, buttocks, and head. Breathe slowly. Keep the position as long as it is comfortable. To release the position, bring down the back of the floor and straighten the head and come back to the sitting posture by placing the palm on the floor and release the lotus posture. Then repeat the steps with the leg crossed on the opposite sides with the lotus posture. Now the inversion poses increases circulation to the pelvic organs and it also prevents premature ejaculation, improve the tone and flexibility of perineal and pelvic muscles, promote the return of venous blood. That is important. It promotes the return of venous blood pooled in the big veins and various venous plexuses in the region of pelvis and perineum, and also enhance the flow of fresh blood to the pelvic viscera. So for this reason, it is useful for to prevent the erectile dysfunction. That includes the Viparit Karani, Sarvangasana, Halasan, etc. And the name Halasan is derived from two Sanskrit words, that is hal, that meaning plow, and asana, that means the posture. Hal is the farming tool used in Indian agriculture. The shape of the body in Halasana resembles that of a plow, and hence the name is Halasana. If you want to do this asana, you have to first lie on your back with your arms beside you and palms downwards. As you inhale, use your abdominal muscles to lift your feet off the floor and raising your legs vertically at 90 degrees. Continue to breathe normally and supporting your hips, your hips and back with your hands. Lift the length off the ground. Allow your legs to sweep in a 180 degrees angle over your head till your toes touches the floor. Your back should be perpendicular to the floor and hold this pose, and after a minute, gently bring your leg down. The relaxation technique that enhances the focus and energy and awareness, that includes the Savasana, that is called pose. And the Savasana is a pose of total relaxation, as my previous speaker tell us that the Shavasana is the king pose actually, and making it one of the most challenging. So that region, as because the relaxation is along with full consciousness. To do the Savasana, you have to first lie flat on your back, like our sleeping pose. Legs should be separated. Keep your arms at your side and your palm facing up. Just relax then. Close your eyes and breathe deeply, slowly through the nostrils. Start concentrating from your head to your feet. This means you are consciously relaxing your each part of the body. Don't move ahead without relaxing particular part of the body. On each inhaling and exhaling, think that your body is totally relaxed. Let your tension, stress, depression, and worry run away on each exhalation. Those having good uh, concentration can practice this shavasana for a long time, and actually uh, others can practice it for 3 to 5 minutes. The pranayama, uh, the diaphragmatic breathing effectively reduces the anxiety level through the reduced sympathetic activities and enhanced vagal activities. Slow breathing technique in pranayama causes comprehensive changes in body physiology by controlling the autonomic nervous system and regularize rate and pattern of breathing. It also regulates heart rate and heart rate variability. Slow pranayama such as Onulam Vilam, uh, Chandranadi, Shitkari, Brahmadi improve cerebral blood flow and oxygenation. As a result, neuronal activities of the brain centers improve sympathophysical output. The Mula Bandha, that is root lock, is the in Tantra actually. The Mula Bandha root lock involves contraction of the perineum, the area between the anus and the genital organs. Mulabandha stretches the pelvic floor muscles and strengthens them, improve the circulation, improve the efficacy of the pelvic and abdominal organs, and then enhance the awareness. There are several mudra we can practice for improving our sexual health. We just mentioned the two mudras, that is Ashwini mudra, that is horse gesture, that it performed by contracting the sphincter muscles of the anus and then relaxing them, and can be practiced anytime, anywhere, in seated or lying down position, and it is believed to awaken the Kundalini Shakti and useful in premature ejaculation. It's very much useful. The Vajrali mudras, that is thunderbolt or spontaneous psychic attitude, is practiced by drawing the urethra upward, the muscle action being similar to holding back an intense urge to urinate. According to yoga physiology, the Vajrali mudra regulates the entire sexual system, and it regulates the testosterone level and the sperm production. It gives control over the premature ejaculation and help erect impotence. So I am just come to the end, and I have some message to take away to you home, that yoga is not a miracle, and it can't cure all the problems. First of all, and yoga is a holistic science and must be learned and practiced with a holistic approach. The dedicated practice of yoga as a way of life is no doubt a panacea for psychosomatic stress-related disorder as well as many sexual disorders. It has side effects, so it should be practiced under guidance. Last of all, may all become happy. May all be free from illness. May all see what is auspicious. May no one suffer. Om peace. Om peace. Om peace. Thank you all for your questions here. Thank you.
Thank you, Palash Rai. Thank you. Excellent presentation. This is what our ancestors enjoyed, their better health, better sexual health. Now today, because of the present day lifestyles, we are depending more on the drugs. We have forgotten our past. Now you made us to recollect our past.
Thank you, sir.
We'll go to the next speaker, another enlightened master, Dr. Su Yin Yap from London. We'll hear from her the usefulness of yoga in female sexual dysfunctions. Over to Dr. Su Yin Yap.
Thank you. Let me just share my screen. Okay. So it gives me great pleasure to be here today on International Day of Yoga. I wanted to thank the organizers of this wonderful event for inviting me to speak. And I'm pleased to be speaking to you about yoga and female sexual problems. As a psychologist specializing in sexual health and someone who practices yoga, it's an area that I'm very interested in. I wanted to focus on the broad meaning of the word yoga, from the Sanskrit word meaning union, as my esteemed panel member said. And I think this word union is absolutely key in the field of sexual health as when applied to the mind-body link, it reminds us that they're not separate. And the danger in sexual medicine is that it can focus too much on the mind and body as separate entities. As a psychologist, I'm interested in the mind-body link and how that relates to sexual problems. So this translation of the word yoga as union seems very fitting. So an overview of today, we're going to look at the biopsychosocial model of sexual functioning and the question, what does yoga have to do with sexual problems? We'll look at some of the research, and we'll look at the mind-body link in female sexual problems, as well as a case study. So the biopsychosocial model, this idea of union fits very nicely with this model, as this approach recognizes that biological, psychological, interpersonal, and sociocultural factors can all affect sexual functioning, and these factors interact with each other in a dynamic way over time. Biological factors are self-explanatory and includes, for example, the role of hormones or medical conditions and the role they play in sexual functioning. Psychological factors includes mental health problems, but also cognitive processes such as self-monitoring and attention, which is something that we're going to look at today. Some examples of interpersonal factors include general satisfaction in a relationship, which we know from research is closely tied to overall sexual satisfaction for women. Finally, some sociocultural factors to consider include religious, cultural, and other social values regarding sex, all of which influence both the patient and the practitioner's attitudes and assumptions about sex and sexuality. So we don't exist in a vacuum. Our culture and society impact on us and shape our beliefs about sex. For example, beliefs about masturbation, ideas about female sexual pleasure are all influenced by culture, values, upbringing, and social messages. And we need to consider all of these factors when addressing female sexual functioning. The psychomedical approach to treating sexual difficulties has a relatively short history, and in contrast, Eastern approaches have, for many millennia, been conceptualizing and addressing sexual complaints. Tantra, Tao, mindfulness, and yoga all have different ways of thinking about sexual functioning and pleasure. And yoga theory suggests that physical and psychological illness results from an imbalanced or blocked chakra system, and it is believed that the chakras directly and indirectly affect the endocrine and nervous system through energy known as life force or prana. Iyengar, the great teacher of yoga, explains that yoga is a way of calming the restless mind, and pranic energy is directed through the body via yogic breath and posture to either maintain or rebalance the chakra system, and therefore heal and sustain the health of the mind and body. There's been growing interest across the globe in investigating the effects of yoga on numerous physical and psychological problems. And the psychological impact of yoga has been studied in healthy populations, and research has shown the benefits on psychological well-being, mood, and life satisfaction. Yoga is associated with reductions in anxiety, anger and aggression, and perceived stress. Neuroendocrine data show that yoga is linked with a decline in cortisol levels, cortisol being the stress hormone. And the psychological impact of yoga has also been studied with clinical populations. A recent systematic review found evidence to support the benefits of yoga for depression, schizophrenia, children with ADHD, and insomnia. So we have a growing body of data to support the mental health and well-being benefits of yoga. And of course, that may have indirect effects on women's sexual functioning. So I have an audience participation question for you. I wanted to ask you, do you think that yoga can help women with sexual problems? So the link is on the slide. And can you please answer question 1 and click on the submit button on the bottom of the screen? So we're going to get the results in live time, hopefully, as people respond. And when we're talking about female sexual problems, we're talking about female sexual interest or arousal disorder, problems with orgasm, and also problems with penetration. Okay, so we're just waiting for responses. So while we're waiting for responses, we'll just keep going and then we can come back to that. Okay, so Mula Bandha is a yogic concept that is relevant to women's sexual functioning. Bandhas are a mean to lock certain areas in the body. The bandhas are thought to facilitate proper functioning of the endocrine system by indirectly influencing the pituitary gland and the brain. Mula Bandha is a perineal contraction, as my esteemed panel member said, and exercising Mula Bandha is similar to the Kegel exercises, often prescribed for women before childbirth and throughout life to reduce urinary incontinence. And I believe we're going to have a piece on this after my talk. Mula Bandha is thought to work the muscles of the pelvic floor, increase circulation and awareness of the area, and thus relieve dysmenorrhea, ease childbirth pain, lessen symptoms of menopause, and improve sexual difficulties. In enhancing women's awareness of their own genital arousal sensations, it may be a helpful adjunct for improving sexual desire and arousal. So in popular culture in the West, yoga is being promoted as a way of enhancing sexual functioning. So when you type yoga and sex into Google, these are some of the results. However, despite all of these writings and teachings and impact on popular culture, actually there is little empirical data on yoga and sexual functioning. So Laurie Brotto, the leading Canadian sex researcher, and her colleagues conducted a review of the literature in 2009 and found only one controlled study of yoga as a treatment for sexual dysfunction. This was a 2007 study from India, which showed the benefits of yoga in treating men with premature ejaculation. However, since Brotto's literature review in 2009, there have been a small number of randomized control trials investigating the impact of yoga on female sexual dysfunction, which we'll look at shortly. So I have another audience participation question, because I was curious to know if you prescribe yoga to your female patients with sexual problems. However, I wonder if there's some technical difficulties with the responses. So we'll keep going, and if they do come through, we can go back to them at the end. So I want to look at the existing published research studies on yoga and female sexual functioning. So this Iranian study from 2014 looks at women with multiple sclerosis and their sexual functioning. MS is a chronic and disabling disease, and 30 to 80% of women with MS suffer from sexual disorders, often caused by injury of neural fibers between genitals and the brain. Fatigue, depression, and pain are also prevalent in MS, which could also affect sexual satisfaction. In this randomized control trial, 60 Iranian women with MS were placed in two equally divided control and case groups through random selection to assess pre and post effects of yoga exercises, both on their physical activity and sexual satisfaction levels. Women in the case group were offered a series of yoga training and exercises for 3 months, and this included asana, pranayama, and meditation. And the yoga group showed improvement in both physical ability and sexual satisfaction levels. So the second study we'll look at is one that investigates yoga as treatment for sexual dysfunction in women with metabolic syndrome. And the prevalence of sexual dysfunction is higher in this patient group than in the general population. In this randomized control study, 41 women with metabolic syndrome aged 30 to 60 were assigned to a 12-week yoga group or a waitlist control. The main outcome measure used was the Female Sexual Function Index, and the yoga group showed significant improvement in arousal and lubrication compared with control. The third and final direct research study is from 2009, published in the Journal of Sexual Medicine. Participants were 40 women ages 22 to 55, enrolled on a 12-week yoga camp in Mumbai. The women were healthy and sexually active, and they completed the Female Sexual Function Index before and after the 12 weeks of yoga. Neither patients nor investigators were briefed about the possible beneficial effects of yoga on sexual health to minimize bias, and a neutral yoga instructor, unconnected with the study, without knowledge of the study's hypothesis, was asked to brief participants about the protocol. So for 1 hour a day, the women practiced 22 yoga postures believed to have positive effects on abdominal and pelvic muscle tone, digestion, joint function, and mood. And you can see a chart there with some of the postures. The results showed a significant improvement in all 6 domains of the Female Sexual Function Index, i.e. desire, arousal, lubrication, orgasm, satisfaction, and pain. And the improvement was greater in older women, women over 45, compared with younger women under 45. Okay. So the mechanisms by which yoga may impact on sexual functioning. So it may be that yoga has a global impact on improving physical and mental health and well-being, which may impact positively on sexual function. It may be due to attentional processes. Yoga has been shown in the research to moderate attention and breathing. It may be due to a reduction in anxiety and stress. We've talked about the research which has shown that yoga decreases anxiety and stress. It may be due to the relaxation effects of yoga. It may be due to the activation of the parasympathetic nervous system. And all of these factors have been shown to be benefits of yoga, and all are associated with improvements in sexual response. Yoga and self-objectification. So I'm presenting this study to you because it may suggest another way that yoga might improve women's sexual functioning. The study asked, can yoga protect against the harmful effects of self-objectification and promote body awareness and responsiveness? This US study, published in 2006, used a small sample, mostly women who were self-selecting. They had signed up to a 2-month immersive yoga course. And the study examined the potential of yoga to buffer against the harmful effects of self-objectification, which is the act of observing and evaluating one's own appearance from an outside perspective. It also examined the question, can yoga promote body awareness and responsiveness? And results show that the women in the study objectify their own bodies less after participation in the yoga program. But furthermore, more frequent yoga practice was associated with increased body awareness. And yoga may be particularly relevant to female sexual problems because of the key role that distractions play in impeding women's sexual functioning. And this is a particular area of interest to me. How does the mind get in the way during sex? And research shows that the more distracted we are during sex, the lower our arousal. And this is relevant to yoga as a treatment for sexual problems, as recent studies have shown the benefits of yoga practice on attentional control. And if women have better control over their attention, they may be less distracted during sex and therefore show improved sexual functioning. So pioneering sex researchers Masters and Johnson were the first to come up with the concept of spectatoring in 1970, and it refers to the thought process of monitoring one's own sexual activity or an intense self-focus during sexual interaction, rather than being immersed in the sensory aspects of a sexual experience. So essentially, during spectatoring, attention is focused inwards. The person becomes distracted by thoughts about their performance, which in turn interrupts the normal flow of sexual functioning and can inhibit sexual arousal and orgasm. In a study published in 2000, researchers asked 74 women about how distracted they were during their sexual activity. Women who reported greater distraction during sexual activity with a partner also reported lower sexual esteem, less sexual satisfaction, less consistent orgasms, and higher incidence of pretending orgasm. So now we've looked at some of the research on yoga and female sexual functioning, and we've looked at the key role that cognitive factors can play, including attention and distraction, spectatoring, and bodily self-objectification. So let's look at a case study that ties this together. So this case is a young woman in her mid-20s, and I saw her in the sexual health clinic. She was referred to me by the GU consultant. She met criteria for the DSM-5 definition of genitopelvic pain and penetration disorder. I've highlighted her symptoms in bold and underlined. So she was complaining of pain during vaginal intercourse, along with anxiety about vaginal penetration. And the DSM recognizes the importance of distress of the patient in making a diagnosis. And this patient was distressed about it. She was distressed enough to seek help, which we know a lot of women don't. We met for an assessment, and it was apparent this was an acquired problem. There was no pain with her first sexual partner. So what do we know from the research about the etiology of this disorder? It's likely multifactorial, so it's complicated. So we took a multidisciplinary approach. She had physical examinations by the gynecologist, and then came to the sexual health clinic where she saw the GU physician. The gynecologist had given her a set of vaginal dilators and told her to insert them on her own. And this hadn't been helpful because the patient had tried, starting with the smallest, found they were painful, felt worse, and had given up. So on assessment, the patient had moderate symptoms of depression and anxiety. She rated her pain on penetration as 7 to 8 out of 10, where 10 is the highest. And she described herself as crying with pain after penetration. So by the time she came to see us, she was frustrated. She told me that she wanted the problem sorted out. And she told me she'd been hoping the gynecologist would find something wrong with her and fix it. So the patient clearly saw this problem as purely biological and purely medical. So we took sexual history. She had 2 longer-term partners in the past and a number of casual partners. The first partner, there was no pain. The pain started after this and was on and off. And when she came to the clinic, she was single. She told me that she had mostly lost interest in sex, but would have sex occasionally because she wanted to see if it still hurt. So what was the psychological impact of this problem on the patient? It was having a significant impact on her life and how she felt about her future. She was worried about starting a serious relationship, and it made her feel hopeless. And what she was experiencing is reflected in the research, which shows that 42% of women with vulvodynia felt out of control of their lives, 60% felt out of control of their bodies, and women felt isolated and invalidated and showed a reduced quality of life. So this triangle is a summary of the key ingredients needed for sexual arousal. Research tells us that when we're sexually aroused, our attention becomes more focused. If that increase in focus is on something we evaluate to be positive sexually, this builds on our physical pleasure and psychological arousal. This is an important aspect of sexual functioning as it allows us to tune out all of the other distractions and maintain arousal and desire. However, if we get distracted by a negative thought, this can lead to a break in the feedback loop, decreased sexual arousal and pleasure. And this is exactly what was happening with my patient. During sex, her attention became focused on negative thoughts, such as, there's something very wrong with me. I'm never going to be able to have pain-free sex. No man will ever want me. I'll never have kids and I'll die alone. So unsurprisingly, this led to a decrease in her arousal. And this conceptualization of the mind-body link and the role thoughts play was key to our work together. And I chose this case to illustrate the powerful role of distraction and what happens when attention becomes hijacked by negative thoughts. So although this is not a case where I used yoga as a treatment, I'm going to highlight two aspects of the intervention, mindfulness and body work, which indicate a role for yogic principles in this sexual problem. So first of all, to take body work, part of the work focused on increasing her bodily awareness. The patient was not aware of the tensing in her legs, her inner thighs, and likely the pelvic floor prior to penetration. So for homework, I got her to rate the tension in her muscles during a self-sensate exercise and helped bring this into her awareness. Then we worked on helping her to gain conscious control over the bodily tensing using breath work and visualization. And through that, she learned to focus on relaxing these muscles. Through activating this mind-body link, the patient increased her bodily awareness and learned that she had control over her body. Another element of the work was using mindfulness meditation techniques, which has been shown to improve attentional focus and has been shown to be beneficial in women with sexual problems. So I taught the patient some simple mindfulness exercises that she could use to improve attentional control and help her refocus her attention onto sexual cues. So the outcome, after 10 sessions of psychology, this patient was able to have pain-free sex. And this case highlights the role of attention in maintaining a sexual problem and also the importance of the mind-body link. And in highlighting the importance of both these factors, there is a potential here for yogic principles to be relevant. The ability of yoga to increase bodily awareness and the meditation elements of yoga mean that this could have been useful in working with a problem like this. So in summary, yoga provides a holistic framework that unites the mind and body, which is sometimes missing from contemporary approaches to female sexual problems. And yoga as a treatment for female sexual problems is an area of untapped potential in terms of the empirical research. Yoga offers a unique approach to enhancing women's sexual functioning. With the development of sound theory and controlled studies, it may play an important role in improving women's sexual problems. Thank you.
Excellent, madam, excellent. Thank you very much for bringing up the modern evidence-based research for endorsing the age-old yoga practice. Excellent. Thank you, madam. Now we will go to, now all the speakers have spoken various aspects of the yoga, how that will be beneficial for the sex. Now today the modern man or the modern woman or modern human beings, they will say, doctor, where is the time for us to do all these things? We are too busy. At the same time, we want good sex. So tell me something shortcut. The shortcut for this procedure is Kegel's exercises or pelvic floor exercises. These pelvic floor exercises, nothing but contraction of pelvic muscles, and relaxation. Because these are the muscles that are responsible for giving tightness in the vagina, responsible for holding the urine, responsible for holding the ejaculation, responsible for holding the fecal matter. So any person who is suffering with these discomforts, say for example, woman suffering with vaginal prolapse, uterine prolapse, urethral seal, erectile prolapse, rectocele, rectal prolapses, or man with ejaculatory problems, man with erectile problems, orgasmic problems. All these things can be addressed to a greater extent by doing these Kegel's exercises, otherwise called pelvic floor muscle exercises. Essentially consists of pubococcygeus muscle, a puborectalis muscle, a iliac, this levator ani muscle, that is iliac muscle. So all these muscles are nothing but three branches of the right and left levator ani muscles. They are forming a platform in the pelvis with three holes in the female and two holes in the male, from anterior to posterior urethra, urethral opening, vaginal opening, and rectal opening in females, urethral opening and rectal opening in the males. So these, at the junction of openings, they will form as a kind of sphincters. Rest of is a muscle plane. So the vitality and good condition of these muscles will play a excellent role for the enhancement of sexual pleasure. This is how one has to do this. So if you look at it here, this is the area where we have to do contraction and relaxation of these pelvic muscles. So this exercise called Kegel's exercise or pelvic muscle exercise, this is more beneficial. Then you may get a doubt when to do. Where is the time for us? For this exercise, no separate extra time is necessary. While doing your office work, while traveling in your bus or train, or while sleeping, before going to sleep, anywhere you can practice this. And nobody sees that you are doing the yoga posture or yoga asanas, because this is internal contraction, relaxation of the pelvic muscles. So you can do it anytime, anywhere. The only thing is empty the bladder and then do this at sitting posture, standing posture, lying down posture, anywhere. How this improves the sexual function in a woman? It tones and strengthens the vaginal muscles and boosts the arousal, causes a tight grip during the intercourse, leads to more intense contractions for orgasm. For males, it allows the men to have stronger and long-lasting erections, keeps the hips and pelvic region healthy, leading to greater control over the ejaculation. So the Vajroli Mudra and Ashwini Mudra is nothing but is a modification of Kegel's exercise, rather vice versa. This holds gives you for a longer control of the ejaculation, prevents the occurrence of erectile dysfunctions. So in short, my friends, by doing Kegel's exercise, one can get these are all the benefits: strengthening the pelvic muscles, helping lubricate vagina after menopause, better sexual function, more orgasmic potential, more bowel and urinary incontinence, helps better erections, increase in thickness of the vaginal wall, improves vaginal health, restores vaginal muscle tone, increase the blood supply, nerve supply to the pelvic region. So all these things will culminate into better appreciation and better quality of sexual life. Now, a video demonstration of the Kegel's exercise. Thank you, my friends. This is how the Kegels exercise will go. Now we'll go to question and answer session.
Yes, sir. Sir, I will read the questions on behalf of you, and probably so you can direct the questions. Our questions are very simple today. The first question is, how
Because
many?
yoga is very clear, it's open.
Yes, sir, definitely. So our first question is, how long per day is required, or how many times in a day? How many was the duration, and how many times a day yoga is recommended in general?
We'll go to Petkar. He is the right person to answer for this.
Yoga, you see, yoga is recommended at least for 1 hour. Say that God has not given you 24 hours. Keep 1 hour for your body. That is very important. And spare 23 hours for others' sake. Is it?
Which
You
time
can-
is preferable?
1 hour
Yes, sir,
is
that's-
preferable.
Yes, that is the total. Which time? What time? Morning, evening, afternoon?
Early in the morning, empty stomach is more important.
Excellent.
And in the evening, if the stomach is empty, you can do if there is a spare time with you.
Yeah.
One can do it.
So it is at least 1 hour it should be there, preferably in the early morning.
And there should not be any laziness. It should be your, you should do as a lifestyle. Do it regularly, daily. Then you will get the results. Not 1 day or 2 days or 3 days. You have to do it very regularly.
One more question has come to me directly, Petkar.
Yeah.
This doctor is asking, after how long doing this procedure we will see the results?
You see, it depends on person to person. You will get the results in some person within 1 week, 2 weeks, 6 months, like that way. How you are doing this is very important. And how take it as a yogasana and pranayama as a pleasure, not as a burden. If you are taking it as a pleasure, you will get the result very soon.
Now, what should we tell to the yoga practitioners, beginners, how long they should do sincerely, holistically, honestly to see the results?
You can see it depends on person to what I'm telling you. It depends on person to person. If you are doing regularly, honestly, you will get the result within 1 month.
1 month.
Within a month, you will get the result.
So we'll take it to 4 weeks. So as per your statement.
Yeah, 4 weeks.
In a broader way, we'll go 4 to 6 weeks to see the results.
Yeah.
Fine. So it takes around 4 to 6 weeks. If anybody does sincerely, honestly to see the results.
Honestly, that word is very important.
Yeah.
Regular, take it as a lifestyle.
Yes. Not doing for the sake of doing. Doing for the sake of
our sake. That's
sake.
very important, not for others' sake.
Next question, Aishwarya ji.
Yes, sir. This is our last question. Basically, it's talking with the entire theme. What are the preferred exercises or postures of yoga related to sexual health? I know we covered many and we spoke about the benefits of each and every exercise, but any favorites you have?
Now, I can divide this question into 2 components. Person suffering with psychological dysfunctions, what are the postures of yogasanas? Person suffering with physical ailments, what are the different asanas? So I will divide into 2 parts and I will go to Dr. Suyin Yap for a person who is suffering with psychological sexual dysfunctions. So what are the yogasanas you recommend to come out of this?
Yes, I think we don't know. I think we don't have enough research yet to say there's one particular asana. I think, looking at the Mumbai study, the 22 postures, they were practiced by women who are new to yoga, and that led to an improvement. So if you go back to the slides and look at that particular slide, you can see that it's a very broad range of postures. But I think the key is the regularity of practice, practicing them. That was 1 hour a day for a couple of months. So I think that, really it's the whole practice of yoga, because we don't know yet the mechanisms by which it works in terms of improving attention and concentration, and what's the minimum level required.
Yeah. So the mindfulness is the most important factor there. So that makes the people to come out of this. As a result of reduction of the cortisol level, improvement of autonomic nervous system. Now we'll go to Dr. Palash Rai. What are the asanas that are recommended for the physical sexual dysfunctions? Palash Rai, unmute yourself.
Not a single asana actually is appropriate for the to improve the sexual dysfunction. Actually, if you see that why the sexual dysfunction is developed, if there is any muscular strength abnormalities, in there is any muscular strength, or there is a hormonal imbalance, or like that, to fix these things, we have to mix up with 2 or 3 asanas actually. We can do pranayama, and that pranayama will improve our brain function as well as the hormonal imbalance. It will fix it, and also the Kegels exercise you see, and that asanas which strengthen the pelvic muscles as well as the pelvic organs will be the best asanas that have to practice for all people who has the sexual problem. I think so.
Say, for example, a patient is having thyroid problem and sexual problem.
Yeah.
Then which asana you recommend?
I will recommend for him pranayama, and also the standing posture. He can exercise the Vajrasana.
Does Shirshasan help them? Thyroid
Yeah.
and parathyroid?
Sorry?
Shirshasan.
Shirshasan, yeah. It also is very important for thyroid.
That's more useful. So like that, depending upon the physical disabilities, we have to choose the particular asana for particular patient. Not all asanas for all patients. That's why I told in the beginning, it has to be first practiced under the guidance, under a senior person or yoga teacher or yoga master, so that depending upon your need and your prevalence of your physical problems and psychological problems, they will give you a cafeteria of choice. This is the suitable thing for you. You practice this. That is very important. Next question, Aishwarya ji. Aishwarya, next question.
Yes, sir. Yes, sir. That's it. We are done with the question and answers. We can have one take-home message from all our speakers in relation to yoga and sexual health. So
we'll begin with our international speaker, Suyi and Yap. Madam, give your take-home message for all the viewers across the globe.
Well, I think yoga has huge potential to help us think about the mind-body link in sex and sexual functioning. I think that's really key. But I think we need more randomized controlled trials to show the mechanisms by which it operates. And I'm particularly interested in the role in attention.
Thank you, madam. Palash Rai?
Yeah. I think that as because yoga is practicing for ancient, since the ancient period actually in India, and that nowadays it is practicing in the whole of the world. And also the person who have the sexual problem, I show in my slide that the person who has sexual problem are not coming to the doctors for seeking the medical help, and this is alarming. And the sexual problem is day by day it is increasing all over the world. And as Sue says that we need empirical research actually for validation of the yoga with different aspects of sexual problem, and also as because the sexual problem has many aspects to happening actually, the physical aspects, the psychological, and also the relationship problem. I think yoga is one solution, the single solution that may improve all the aspects of that may cause the sexual problem. So it may be a good alternative for the sexual problem, and I think it is very good option for alleviate the sexual problem. That's all.
Thank you. Thank you, Kailash. We'll go to Dr. Sudhakar Petkar.
Yeah, I will say that take the oath on this auspicious occasion of International Yoga Day that I will do the yoga regularly and I will live happily, healthy life, not healthy, but longer life but with sex life. That you should take the this take home message. Do the regular yoga. That is the only thing and only thing to prevent the sexual problems.
Yes, excellent. So yoga can lead to, practicing yoga sincerely can lead to good sexual life. That all the speakers have enumerated that. Now, good sexual life can lead to ultimate the target or ultimate goal of human being, ultimate goal of life. That is assuming, mixing the Jivatma with the Paramatma. The school of the Osho school of thought, Osho's, there is a headquarters at Pune. These Osho's people will speak about this. By enjoying the sexual life, one can lead to penance, ultimate thing. The ultimate thing is this Jivatma is mixing with the Paramatma. So that is the penance. So that is the ultimate way it leads to. That's why enjoying a healthy sexual life is very, very necessary. For that, yoga definitely contributes. It is beyond doubt. All panelists have given their evidences for this. And I thank all the panelists for coming forward and sharing their knowledge and helping all the viewers. I thank them profusely. Thank you and thank you and thank you.
Thank you.
Thank you, sir. On behalf of all our audiences and our team, I want to thank our international speakers, special thanks to international speakers, Dr. Palash Roy, sir, and Dr. Suyayan, ma'am. And a big, big thank you to our best moderator, Dr. Venkat Ramana, sir, and our Dr. Sudhakar Petkar, sir. It was a privilege to hear from all of you, and we look forward to see you in the live program. Thank you so much for today.
Thank you. Good night.
Thank you. Bye.
Bye bye. Thank you.